Hello, my name is Jody Hillard, and this is my boss, Carrie Harkins, or stakeholder, excuse me. And today we are going to go over my research paper, COVID-19 in healthcare. It's always a big topic in this clinic for COVID, especially since it's coming back up again. So, getting started right off with the definition of my topic. Definition of my topic is that the coronavirus has been a global worry since March 11th of 2020 when it was announced a global pandemic. There have been people all over the world who have been diagnosed with COVID, have been contracting long-term health conditions, and in most cases, death. Patients with underlying health issues are too scared to go to the doctor, even try to make a doctor's visit with anybody. They're too scared to go to urgent care, to the emergency room, to go anywhere because they're scared of contracting this virus. The issue with COVID and the healthcare is that patients do not have the correct knowledge on how to protect themselves while out in public. The background of my problem is basically COVID-19. That's the problem for everything right now. I feel like if the public were, not that they weren't prepared, if they would have paid attention more and taken the seriousness of this virus, it would not have been such an issue. But with our small town and small community, it's a struggle just because of how stubborn people are and political views and all of it. So, the main problem is that the public in our area does not have enough knowledge about COVID-19. This affects our organization here in the rural clinic and in the rural hospital. People do not understand that this disease is highly contagious, and it shows the same symptoms as type A and type B flu. In our organization, we try to control how many people are in the building at a time, just so we can backtrack in case something happens, in case one of our providers or a nurse or somebody gets COVID. So we have our PSRs. We used to have somebody sitting at the front door with a list of symptoms, and we checked temperatures, and if they had a guest, we had to do the same thing for them. But since it has kind of calmed down now, we just ask them the questions from the computer, and their temperatures are taken in the rooms whenever they get back with the nurse. But since then, we have been letting everybody into the building, because most doctors, they do want to listen to their lungs, because that's one thing that COVID does affect. So we have been letting people inside the building and kind of just watching out what kind of symptoms people have. And some people just don't understand the importance of the screenings either. Before, when it was really bad, they would lie to us up front, and then they'd get back to the room and say, oh, I've been running a fever for this many days, and I can't taste or smell. And then it would just be a fiasco because they would have COVID, and they'd come into the clinic, and it'd just take extra time for the nurses to clean the room, us to clean the lobby. It was a nightmare. It still is a nightmare. And one other issue that we had was one of our doctors, he's retired now, he retired in July, but we tried to watch out and who was coming in and out because he has progressing lung cancer, and that he's doing treatments for. So we wanted to keep him safe as well. So my first source is YouTube, I know, of all places. But YouTube, really anything that goes on in the world, people are going to turn to the internet. I mean, Facebook, Instagram, anything. Some kind of social media. So in this article, it discusses pretty much how-to videos on how to protect yourself from COVID-19, going out in public, how you need to sanitize, wash your hands when you get home with soap and water, how they also mentioned that hand sanitizer is not a substitute for hand washing with soap and water, so you need to do both. Staying 6 feet apart, just keeping away from people, and not getting out unless you absolutely have to. So these how-to videos were created by a bunch of medical students, and they were sorted into different categories, and they were put on the CDC website for people to look at. And it's relevant to this clinic because the patients are still oblivious to coming into the clinic for doctor's appointments. I don't know how many masks I've handed out today alone, at least half a box of 50. So they're all the time, and it's there's 3 of us up there, so we're all the time handing out masks. One thing that did happen was COVID took a little bit of a break, and you didn't hear about it for a while, and it wasn't a big worry until the Delta variant came. And then they were acting like it started all over again. They didn't know how to do anything. They were coming out without masks on. They weren't social distancing. They weren't washing their hands and sanitizing again. And so it was a big uproar again. And we have a problem here whenever we hand out the masks to the patients. When they get done with them, instead of disposing of them in their trash at home or just leaving them in their car or whatever, they throw them in our parking lot. So it's really just a kick in the face towards us, since we're trying to protect these people. My second source is on delayed emergency surgical presentations. And this article talks about the cases, pediatric cases, not in the U.S., which I'm sure you can find many from the U.S., but this is in a different country. Their parents were scared to take them to the doctor to be treated for anything, and they had underlying health issues, cancer, just whatever, and their parents were too scared because they did not want to contract COVID. And when they finally were admitted to the hospital, they were admitted straight to the ICU, and 4 children died from the parents, because they're not prepared to go out in public. So if they would have practiced good hygiene and social distancing, it could have been a different outcome. And with limited appointment slots here at the clinic, we are automatically sending people to urgent cares, to the emergency room, to different clinics if they can get in there, because there's literally nowhere to put them because people are sick, and you gotta practice social distancing. This next one is a big one for us. We're in a clinic, we're not in a hospital, but they do these in the hospital. It's the virtual bedside for patients. This is a big thing that was, if they were sick, if you needed to come or needed to make an appointment, if you had any of the symptoms, they would do virtual or telephone visits with you, and that way you could get started on antibiotics and or whatever they called in for them. And with the rise of the virus coming back for a 3rd time, there's a new variant now, the Omicron variant. The physicians in the office would much rather keep yourself safe, do telephone visits, request telephone visits, virtual visits, than risk patients coming in and getting them sick or making other patients sick in the clinic. And when it comes to patient safety, we go above and beyond to keep them safe. And then another article that I read, it's the pre-systematic review on the use of masks as a protection material against COVID-19. So really the big question with this article was, do masks really keep you safe? The answer is to an extent. Nothing's going to keep us safe, just like nothing's going to keep us safe from having the flu or a cold or whatever. You get it. But studies found that, they tested COVID-19 patients with COVID-19, and they tested patients without cotton masks. They were found to be not good. They did not stop the spread of the virus. But if you had certain gear, so like if you're working in the hospital setting or in a clinic setting, if you needed to, with a gown, visor, N95 mask, goggles, gloves, all the protection, it helped stop the spread of COVID-19. And then my last source was on rural healthcare delivery organizations and COVID-19, which we do not do any delivery here at the clinic. We have pharmacies around town that do, but majority of our patient intake is elderly. They are elderly patients who they live alone and they don't know anything about the virus. They don't care because of their political views, or they don't get out of the house and they're sick as well. It's just like everybody else. But they are the ones more at risk because of their age and their health. Around here in the hospital and the clinic, there have been limited resources and rapid training methods, but still not anything good enough to protect the citizens or help prepare themselves to protect themselves. And I realize, and she realizes, we will not always be protected by this virus, but we just need to ensure each other and ensure our patients that they need to take those certain precautions so they can stay safe. So on the methods section is, once again, the public just does not have enough knowledge. They don't understand, some don't understand the rate of how this is going. People are still coming in, like I said earlier, they still come in and wonder why you have to wear a mask. That's not our rule, that's our organization's rule. And one question I did have for the public is what kind of training they have gone through, which not many of them have gone through training. The training they've gone through is sitting in the recliner and watching TV. And one question I have for them is that, do you think that the healthcare providers and healthcare workers have had enough training to keep you safe? My sampling strategy for this research I suggested was a cluster sampling. It could be divided into different units. So, for example, based on people's age, their profession, and their political reviews. I said that the timeline would start 6 months after the pandemic, just to see, it started in March, so 6 months after that would be September. Mm-hmm. So, just what their view on masks and keeping safe and social distancing and that kind of thing, what their view on that would be. And the surveys would go through the mail. Through our organization, we have a mail service where we can just send it on to the courier and it'll get mailed out to patients immediately. And it would go through mail and email to patients who were doing video and telephone visits, or those who had not shown up for appointments at all or even called to make an appointment. The limitations based on this survey would be that the questionnaires that we received back from the patients would either be halfway filled out or not filled out at all, or through patients who were disabled and live alone and don't have anybody to help them and can't fill out a survey by themselves, or just didn't understand it and threw it in the trash, and so we never received it back. The budget on this, the research project is better understood that the views of the patients and healthcare workers during this global pandemic. The funding for this research would be low cost because of our questionnaires and would be sent through the email or mail via our courier, and the envelopes are already stamped, and so the patients can fill out and send it right back. So it'd be low cost. So on my findings, for some of my questions, one of my questions was, how do you feel working during a global pandemic? These are towards my coworkers. A lot of them said that it was very overwhelming. They were scared and they do not always feel safe, especially when patients fail to take precautions because they don't want to get sick. Another question is, after a year of the pandemic, how do you feel now compared to how you felt when the pandemic was announced? They said they still felt a little overwhelmed by it all. It's hard to feel prepared for something like this when rules and regulations change daily. We're constantly on the CDC website, just checking to see what has changed and what needs to be done here at the clinic that we can work with. I asked the healthcare workers here if there was a rule they could change, what would it be? And they said the one rule that all healthcare workers voted to be changed was that anytime someone walked in without a mask, they would have to immediately exit and wait for a mask to be brought to them. This is one of the big ones. They are big on the mask, just like I am. Then I asked them, do you feel like patients were properly prepared by the state for this pandemic? And I said all participants agreed that yes, patients should be prepared to go out in public with the correct protection. It's been on the news forever, for over a year, so they should know. And the last question I asked them was, do you feel like the patients care for the well-being of their providers? And they agreed again, no, they feel like their patients do not care about their well-being, because if they did, they would follow the correct protocols. So my plan of action for this survey and for these answers to my questions was that if they're sick, we need to enforce virtual visits again. I know it stinks, and Dr. Bird's a big stickler and wants to have her patients come in, but sometimes that can't always be the case. I say, since the Omicron variant is it's here and COVID's coming back again, that we have somebody sitting out at the front door again, screening everyone. I don't think we should let guests in the building. We just need to let the patient in unless they're a child or disabled. And one other thing I think we should do is we should close the clinic during lunch. So the providers do lunch from 12 to 1. And everyone pick an exam room and the lobby. Whoever is out in the lobby, they clean the lobby periodically. But everybody pick an exam room and spend 5 to 10 minutes on that exam room and just clean. Just sanitize everything, the beds, the equipment in there, the keyboards, the computers, before afternoon clinic starts. And then whenever Connie gets here in the afternoon, she does it anyway. So, and the implemented budget for this would not be expensive either. Virtual visits for the clinic, those vary. Not really, even with us, it just varies with people's copays. I mean, it does not cost us money to do virtual visits. Neither does having someone sit at the front door. There's 3 PSRs here. 2 of us can handle checking in patients and answering phone calls, while the other one sits out there and gets up and cleans periodically. But the person who sits out there would also be included in this last one, for closing the clinic from 12 to 1. So they clock out at 12. Cleaning's going to take into their lunch hour, their cleaning time. So $5 for every minute used to clean the exam rooms, along with the PSR doing the lobby. Because coworkers would be using their lunch break. So that's my COVID-19 action plan budget. And then all my references from everything. So that is my view on COVID protection and healthcare. Ms. Carey, do you have any questions?
No. Very good.
Thank you. That is all for today. And I appreciate you sitting with me and listening to my research paper. So again, thank you, and thank you, Ms. Scott.